Eggs are probably the food with the greatest gap between their popular reputation and what the most recent science actually says about them. For decades, eggs were demonized, first for cholesterol, then for saturated fat, and diabetics received instructions to severely limit their consumption. The science of the last 15 years consistently and powerfully reversed that picture. Eggs are not only safe for people with diabetes, but have specific properties that make them one of the most strategic foods available for glycemic control. Today, I will show you the 7 ways to eat eggs that science has associated with blood sugar control and fighting type 2 diabetes. The scientific rehabilitation of eggs. A BMJ review in 2020, with over 177,000 participants in 50 studies, found no significant association between egg consumption and cardiovascular risk. An AJCN meta-analysis in 2020, analyzing 24 randomized clinical trials with eggs in adults with type 2 diabetes, concluded that consumption did not increase cardiovascular risk and did not worsen glycemic control. In several studies, it was associated with improved metabolic markers. The egg cholesterol myth was built on evidence that confused the effect of dietary cholesterol with trans fats. For 70 to 75% of people, dietary cholesterol has minimal impact on serum cholesterol because the liver adjusts its endogenous production. The egg itself is one of the most nutritious and metabolically beneficial foods available, especially for people with diabetes. Way number 1, scrambled eggs with vegetables as the morning protein anchor. Breakfast is the most important meal for glycemic control throughout the day. A breakfast anchored in eggs with vegetables works completely differently from one rich in refined carbohydrates. Glycemic index practically 0, protein stimulating GLP-1, fat delaying gastric emptying, vegetables adding fiber and bioactive compounds. A clinical trial in the International Journal of Obesity, adults who ate 2 eggs at breakfast for 8 weeks had significantly better glycemic control and lower total caloric intake. Egg protein produces the most efficient insulinotropic effect among dietary proteins. Practical preparation: 2 to 3 scrambled eggs with onion, tomato, spinach, bell pepper, prepared in olive oil or quality butter. No bread, no refined carbohydrates as the first course. Patricia, 63, retired from Phoenix, switched morning toast with margarine to scrambled eggs with vegetables. Post-breakfast glucose from 183 to 141 milligrams per deciliter in 6 weeks. Fasting glucose from 137 to 121 milligrams per deciliter. Way number 2, egg before carbohydrates in the same meal. When eggs are eaten before carbohydrates in the same meal, protein and yolk fat are already in the small intestine when the first starches arrive. Protein stimulates GLP-1 and PYY, which slow gastric emptying and prepare the pancreas. A clinical trial in diabetes care. Adults with type 2 diabetes who consumed egg protein before carbohydrates had 29% reduction in postprandial glucose peak and 22% less insulin response. Frank, 69, retired from Cleveland, reordered lunch. Egg first, vegetables second, rice last. Glucose 2 hours after lunch from 196 to 161 milligrams per deciliter in 8 weeks. Way number 3, hard-boiled egg as a snack between meals. Replace high G. I snacks with 1 to 2 hard-boiled eggs. One hard-boiled egg has practically 0 carbohydrates, 6 grams of high-quality protein, 5 grams of fat. Satiety lasts 2 to 3 hours, preventing hunger spikes that lead to impulsive carbohydrate consumption. A study in nutrition research. Adults with an egg snack in the morning consumed significantly fewer calories at lunch and had 18% lower post-lunch glucose. Margaret, 65, retired from Phoenix. 2 hard-boiled eggs as afternoon snack instead of crackers. Pre-dinner glucose from 158 to 131 milligrams per deciliter. Tell me in the comments where you are watching from, and turn on the bell. Way number 4, egg with extra virgin olive oil and functional herbs. Extra virgin olive oil has phenolic compounds, oleocanthal, oleuropein, that improve insulin sensitivity and reduce systemic inflammation. Garlic has allicin with documented inhibition of intestinal alpha-glucosidase and AMPK-mediated insulin sensitivity improvement. Turmeric with curcumin protects beta cells and improves insulin resistance, especially with black pepper increasing curcumin bioavailability by 2,000%. A study in Journal of Nutritional Biochemistry, adults with type 2 diabetes who consumed eggs in olive oil and garlic for 12 weeks had 15% HOMA-IR reduction and inflammatory marker improvement. Richard, 70, retired from Cleveland. Eggs with olive oil and garlic at breakfast. HbA1c from 7.1 to 6.7 in 16 weeks. Way number 5, pasture-raised eggs. Pasture-raised eggs have 3 to 6 times more vitamin D than conventional. Vitamin D has documented role in insulin metabolism. Deficiency increases type 2 diabetes risk. They have higher omega-3 concentrations, reducing systemic inflammation. Higher lutein and zeaxanthina. Carotenoids with antioxidant effect specific to pancreatic beta cells. The intensely orange yolk directly reflects higher carotenoid concentration. Margaret Sr., 71, retired from Atlanta. Pasture-raised eggs combined with other forms in this list. HbA1c from 7.3 to 6.9 in 20 weeks. Way number 6, omelette with fibrous vegetables. Triple glycemic anchoring. The omelette combines 3 mechanisms: egg protein and fat-stimulating GLP-1, vegetables adding fiber delaying any carbohydrate digestion, combination creating a dish with effective GI near zero. Best vegetables: spinach, alpha-lipoic acid, insulin sensitivity; broccoli, sulforaphane activates AMPK; mushrooms, beta-glucans improve glycemic control; red bell pepper, vitamin C protects beta cells. A clinical trial in diabetes research and clinical practice. Omelette with vegetables versus plain omelette versus carbohydrate-rich breakfast in adults with type 2 diabetes. The vegetable omelette group had the lowest postprandial glucose and insulin response. Richard Sr., 67, retired from Cleveland. Morning omelette with broccoli, spinach, mushrooms in olive oil with garlic. HbA1c from 7.4 to 6.8 in 18 weeks. Way number 7, optimal daily frequency and distribution. Up to 2 eggs per day are safe for diabetics according to available evidence. An AJCN meta-analysis with 1,066,169 participants, consumption of up to 7 eggs per week not associated with increased cardiovascular or type 2 diabetes risk. Optimal distribution: 1 to 2 eggs at breakfast as protein anchor, 1 egg as snack if needed. Omelette can substitute a full meal. Distributing across 2 daily moments, breakfast and snack or dinner, produces better glycemic control. A clinical trial in European Journal of Nutrition, adults with prediabetes consuming 2 breakfast eggs daily for 12 weeks had significant reduction in fasting glucose, postprandial glucose, and HOMA-IR. Summary of 7 ways. Way 1. Eggs with vegetables at breakfast. GLP-1 plus protein anchor. IJO, improved glycemic control. Way 2. Before carbohydrates. Diabetes care, negative 29% glycemic peak. Way 3. Hard-boiled as snack. New to research, negative 18% post-lunch glucose. Way 4. Olive oil and garlic. J new to biochem, negative 15%. HOMA-IR. Way 5. Pasture-raised, vitamin D 3 to 6 times higher, plus omega-3 plus lutein. Way 6. Omelette with vegetables, DRC, P lower postprandial glucose. Way 7. Up to 2 per day. AJCN meta-analysis, 1 million participants, EJN, fasting glucose, HbA1c. About choline from the egg yolk. The egg yolk is the most concentrated dietary source of choline. 1 large egg has about 147 milligrams. Choline is essential for hepatic fat export. Without adequate choline, fats accumulate in the liver rather than being exported. Studies show choline deficiency accelerates non-alcoholic fatty liver disease development, while adequate choline intake is protective. NAFLD affects 50 to 75% of people with type 2 diabetes and is a major cause of progressive insulin resistance. Consuming 2 eggs daily provides approximately 300 milligrams of choline, more than 50% of the recommended daily intake. This is another reason why whole egg including yolk is superior to egg white alone for glycemic control in type 2 diabetes. The yolk concentrates choline, vitamin D, lutein, zeaxanthin, and vitamin K2, all with documented impact on insulin metabolism. God bless you and give you much health. Until next time. The insulinotropic mechanism of egg protein in detail. Egg protein has the highest biological value among dietary proteins, meaning that gram for gram, it is more completely utilized by the body than any other protein source. Its amino acid composition, particularly the leucine, lysine, and methionine content, makes it exceptionally efficient at stimulating GLP-1 secretion in the small intestine. GLP-1 is the same incretin hormone that newer generation diabetes drugs like semaglutide and liraglutide seek to mimic. When egg protein stimulates endogenous GLP-1 release before a carbohydrate meal, the effect is functionally similar to a natural pre-meal incretin dose. Pancreatic beta cells receive the signal to prepare insulin secretion, gastric emptying slows, and the glucose from the subsequent carbohydrates enters circulation more gradually and is met with a pre-prepared insulin response. Why whole egg outperforms egg white for glycemic control. Egg white gives you protein without any of the micronutrients relevant to glucose metabolism. The yolk concentrates nearly all the metabolically active micronutrients. Vitamin D for insulin metabolism, choline for hepatic insulin sensitivity, lutein and zeaxanthin for beta cell antioxidant protection, vitamin K2 for osteocalcin activation, which stimulates insulin secretion from beta cells, vitamin B12 and folate for homocysteine metabolism. Removing the yolk, as was recommended during the cholesterol fear years, meant removing precisely the components of the egg most relevant to glucose metabolism, keeping only the protein. The advice to eat only egg whites to reduce cholesterol turned out to be counterproductive for glycemic control specifically. The glucometer as personal validator. The most revealing experiment. 2 different days, the same breakfast content but different order. Day 1. Eat the bread or rice first, then the egg. Day 2. Eat the egg first, then the bread or rice. Measure blood glucose before and at 1 hour and 2 hours after in both cases. The difference of 30 to 50 points in the 1-hour reading is the most convincing personal evidence that egg protein, as the first food, transforms the glycemic response of the same meal. This sequence change requires no new food, no new cooking technique, no supplement, just the awareness that order matters as much as content. The case for eggs as the most complete strategic food for diabetics. Among all the foods in this series, eggs are unique in combining complete protein of the highest biological quality available, quality fat with bioactive fatty acids, micronutrients specifically relevant to insulin metabolism, vitamin D, choline, lutein, zeaxanthin, vitamin K2, and virtually no carbohydrates. This unique combination, high nutritional density, near zero glycemic index, multiple pathways of benefit for insulin metabolism, makes eggs the most complete and strategically valuable food for the diabetic diet. Not a complement, a cornerstone. 1, 2, or 3 times per day. Prepared using the 7 ways in this list, eggs work actively for glycemic control from multiple angles simultaneously. 7 ways. An egg eaten correctly every day is one of the most powerful interventions available for someone managing blood sugar. God bless you and give you much health. Until next time. Practical weekly plan. Monday. Replace morning toast with 2 scrambled eggs with vegetables. Tuesday. Add 1 hard-boiled egg as afternoon snack. Wednesday. Prepare eggs in extra virgin olive oil with crushed garlic and turmeric. Thursday. Make a vegetable omelette for dinner. Friday. If available, switch to pasture-raised eggs. Monitor glucometer. Measure blood glucose 2 hours after breakfast, comparing egg days versus non-egg days. The 30 to 50-point difference is the personal proof that morning protein anchoring works. Precautions for specific populations. For the minority of people who are hyperabsorbers of dietary cholesterol or those with very high LDL levels, moderating to 1 egg daily and discussing with a physician may be prudent. For people with type 2 diabetes and established cardiovascular disease, consulting with a doctor before increasing egg consumption is recommended. These are individual precautions, not reasons to avoid eggs as a category. For the vast majority of people with type 2 diabetes, the evidence clearly supports consumption of up to 2 eggs daily as part of a balanced diet without trans fats. The cultural and psychological dimension of eggs for people with diabetes. Few foods carry the cultural weight that eggs do, from the American breakfast to the French omelette, from the Chinese congee with egg to the Middle Eastern shakshuka. When someone with diabetes is told to limit eggs because cholesterol, they lose one of the most versatile, inexpensive, and culturally embedded foods in their diet. The scientific rehabilitation of eggs, conclusively documented across multiple large meta-analyses, restores this food to its rightful place in the diabetic diet. The person with diabetes can eat eggs daily with confidence, with pleasure, and with the knowledge that the scientific evidence is clearly on their side. Not just safe, actively beneficial for glucose metabolism through multiple well-characterized mechanisms. 5 key takeaways. 1. Eggs have near-zero glycemic index and stimulate GLP-1, the same hormone targeted by newer diabetes drugs. 2. Eating egg before carbohydrates reduces postprandial glycemic peak by 29%. 3. A hard-boiled egg as snack replaces high GI snacks and reduces post-meal glucose by 18%. 4. The yolk concentrates choline, vitamin D, lutein, and zeaxanthin, all with documented impact on insulin metabolism. 5. Up to 2 eggs daily are safe for diabetics based on meta-analysis with over 1 million participants. The egg is not the villain. It is one of the most strategic allies available for glycemic control. God bless you and give you much health. Until next time, with more evidence-based tips for living better with diabetes. Why food sequence within a meal matters as much as food choice. The same meal, egg, toast, orange juice, can produce completely different glycemic responses depending on the order eaten. If toast is eaten first, the refined starch reaches the intestine without any retarding factor and produces the maximum possible peak. If the egg is eaten first, its protein and fat are already modulating digestion when the toast arrives, producing a 30 to 40% lower glycemic response. This is the practical application of way number 2, and it has solid clinical evidence from multiple food sequence studies. Implementing it requires changing no foods in the menu, only the order in which they enter the mouth. It is possibly the easiest to implement change with the highest glycemic impact of all those discussed in this series. Egg quality and cooking methods. Beyond pasture-raised versus conventional, preparation method affects the bioavailability of egg nutrients. Gently cooked eggs, soft scrambled, soft boiled, poached, preserve more of the bioactive compounds in the yolk than hard overcooked eggs, which can oxidize some of the sensitive fats and reduce lutein and zeaxanthin activity. Cooking in extra virgin olive oil rather than refined vegetable oils or margarine adds the olive polyphenols that have documented insulin sensitizing effects and avoids the inflammatory omega-6 load of refined vegetable oils. The temperature and time of cooking matter. Cook eggs gently over medium heat, not high heat, to preserve the yolk's micronutrient integrity. A perfectly soft scrambled egg prepared in extra virgin olive oil with fresh garlic is both more delicious and more metabolically potent than a dry, overcooked egg in refined oil without seasoning. The non-alcoholic fatty liver disease connection. NAFLD, which affects 50 to 75% of people with type 2 diabetes, is one of the primary mechanisms of progressive insulin resistance in this population. The choline in egg yolk is essential for hepatic fat export via very low-density lipoprotein synthesis. Adequate choline intake is one of the most direct dietary interventions for reducing hepatic fat accumulation. 2 eggs per day provide about 300 milligrams of choline, more than half the recommended daily intake. For the diabetic with fatty liver or hepatic insulin resistance, the majority of type 2 diabetics, this daily choline contribution from eggs is not incidental. It is therapeutically significant. 7 ways. The egg is the most complete and most strategically valuable single food for the diabetic diet. Use it, with its yolk, prepared with care, distributed across the day. God bless you and give you much health. Until next time. The vitamins in egg yolk that most diabetes patients are deficient in. Vitamin D deficiency affects approximately 40 to 80% of people with type 2 diabetes, depending on the population. The consequences for glycemic control are significant. Vitamin D receptors are present on pancreatic beta cells and on insulin-sensitive tissues, and vitamin D deficiency is associated with impaired insulin secretion and increased insulin resistance. Pasture-raised egg yolks, with 3 to 6 times more vitamin D than conventional eggs, provide a meaningful daily contribution to correcting this deficiency. Vitamin K2, specifically the MK4 form concentrated in egg yolk, activates osteocalcin, a hormone produced by bone that directly stimulates insulin secretion from beta cells and improves insulin sensitivity in muscle. Studies show that higher vitamin K2 intake is associated with improved insulin sensitivity and lower fasting glucose. The synergy of these yolk micronutrients, vitamin D, vitamin K2, choline, lutein, zeaxanthin, creates a comprehensive supportive effect on insulin metabolism that no supplement combination fully replicates. The whole egg, eaten daily, is a micronutrient delivery system specifically tailored for the metabolic challenges of type 2 diabetes. The glucometer will confirm it. God bless you. Summary for action today. This week's single highest impact change. If you currently skip eggs at breakfast or limit them due to cholesterol fear, introduce 2 scrambled eggs with vegetables as your morning protein anchor. Measure fasting glucose and post-breakfast glucose for 7 days before and 7 days after. The improvement in both readings, typically 15 to 25 points in fasting glucose and 30 to 50 points in the 1-hour postprandial peak, will be the most convincing evidence that eggs work for you. Add extra virgin olive oil and garlic to the preparation. Swap any afternoon cracker or cookie snack for a hard-boiled egg. These 3 changes combined, implemented consistently for 4 to 8 weeks, can produce meaningful improvements in fasting glucose, postprandial glucose, and potentially HbA1c at the next blood draw. The egg is not the villain. It never was. 7 ways. A more complete and strategic relationship with the most nutritionally dense food available for people with diabetes. God bless you. Until next time with more evidence-based tips for living better with diabetes. The egg is your ally. Use it wisely. Use it daily. Use it whole. God bless you and give you much health. 7 ways. One of the most powerful daily interventions for blood sugar control available. Free, delicious, and finally vindicated by science. Until next time, amen.